Hi, good afternoon. Welcome to Ask Dr. Icon. I'm Dr. Tan Yew Oo, a medical oncologist at Icon Cancer Center, Singapore. Today, I'll be answering your question on stomach cancer, also commonly known as gastric carcinoma or gastric cancer. First question that I'm going to answer was submitted, which is asking, is there a screening test to detect stomach cancer? Well, stomach cancer screening is not recommended for everybody. However, unlike breast and colorectal cancer or even cervical cancer, there is no regular screening program as recommended by the Health Promotion Board or Ministry of Health. However, there are some high-risk individuals who should have regular screening for stomach cancer, and they include people with strong family history of stomach cancer or even some colonic cancers. And also, if you have pre-existing stomach ailments like Helicobacter pylori infection or chronic gastritis or previous stomach surgery for ulcer, or if people who have high frequency for stomach polyps, or those people who smoke heavily or consume a lot of alcohol, or who have obesity as a problem, and also eating salted and preserved food can be considered a high risk. So the usual and best way of screening cancer is through doing endoscopy, or sometimes called OGD, which stands for esophageal gastroduodenoscopy. What it involves is passing a telescope down through the gullet or the esophagus, and then they can pass it down to the stomach and down to the first part of the small intestine called the duodenum. This is probably the best way and the most accurate way to detect early gastric cancer or to find if somebody has got stomach cancer. However, recently there are other methods involving blood tests, and a very recent example is a blood test developed in Singapore using microRNA that can identify people with high risk for early stomach cancer. And through the blood test, together with the OGD, you can use that as a form of screening test for stomach cancer. So the person who does the endoscopy will have to look very carefully on the surface of the stomach wall to see if there's any ulcers or any abnormality that looks suspicious. And they then pass in a small forceps to take a biopsy of the abnormal area and send it for examination to see under the microscope if there is any evidence for gastric cancer. And that is probably the best way of detecting early gastric cancer. The next question we received today is asking if the person is at high risk for developing stomach cancer if he or she has a frequent acid reflux or sometimes gastritis. People with frequent reflux or gastritis, they should see a doctor to consider undergoing OGD as a way of screening for stomach cancer. Because through this endoscopy, they can look to see whether there is any ulcer or any tumor. And not all ulcers are stomach cancer. Sometimes you can have stomach ulcer that are benign, and through the endoscopy, you can take a biopsy to see whether there are any malignant cells. So not everyone with stomach polyp or stomach ulcer have stomach cancer. So in order to follow up after the biopsy, if they have Helicobacter pylori or sometimes called H. pylori infection, this category of patients have a higher risk of stomach cancer, and they should undergo more frequent screening in subsequent examination. And don't just assume that it's just gastritis and go away if the discomfort persists. So I would advise people with frequent gastritis or stomach discomfort that they should seek a specialist doctor who can do endoscopy of the stomach to make sure they don't have any infection or any ulcer or any possibility of stomach cancer. I think this is very important. I'd like to tackle the next question we received, where the person is asking, if I have advanced stomach cancer, what are my treatment options? This is a very important and a very loaded question. Let me try to describe what is advanced stomach cancer. So advanced stomach cancer can mean locally advanced stomach cancer, where the cancer is locally advanced, is confined to the stomach and through the stomach wall and to the regional lymph nodes. That's usually called a stage 3 locally advanced stomach cancer. And sometimes you can only determine that your locally advanced disease after the surgeon has done an operation of the stomach, or sometimes we use a technique called endoscopic ultrasound guided biopsy to determine that this is locally advanced. So in locally advanced stomach cancer, we tend to involve other specialists like the surgeons and the gastroenterologists to determine whether surgery is indicated. And we have to do a proper staging evaluation where we need to do scans such as a CT scan or a PET scan or even sometimes MRI to determine the extent of the involvement of the stomach cancer. So when the gastroenterologist or whoever does the scope, they need to do a good biopsy of the abnormal area and send for analysis. The pathologist will then confirm that this is stomach cancer, and we usually ask the pathologist to include certain molecular testing to be done, because about 20% of stomach cancer have a gene called HER2. You may have heard of HER2 in breast cancer, but in stomach cancer, they have HER2 overexpression too. If they have HER2 overexpression in locally advanced or metastatic stomach cancer, we use a targeted therapy called trastuzumab together with chemotherapy to treat the cancer after or before doing the surgery. And in recent times, we now have a new drug called antibody drug conjugate, ADC for short. And it's got a very long name called trastuzumab deruxtecan. This is a very wonderful drug where with one drug, it is both a targeted drug together with a chemotherapy that is attached to the antibody, and the antibody drug conjugate gets into the cancer cells and then release the chemotherapy and kill the cancer. And this is a very new advanced drug that has just been approved in Singapore less than a year ago. Another way where we always combine chemotherapy with immunotherapy. And for immunotherapy to be useful, we have to do a test called PDL1 to see whether immunotherapy can be combined with chemotherapy. Because the major advance in the last few years of treating stomach cancer is a combination of chemotherapy with immunotherapy as a way to control advanced stomach cancer better than using chemotherapy alone. And this has changed and prolonged the life of many patients with advanced stomach cancer today. We have now come to the end of our talk, but I hope that I've answered most of your questions, and I want to end this talk by emphasizing that those people who fall into the high risk category, which I described earlier, should consider having some form of screening test. And as I said, one of the recent advances in cancer screening is the availability of a non-invasive method using just blood tests to detect what we call microRNA, which will then help us to identify some of these high-risk patients who may carry a higher genomic changes in their blood to predispose them to getting stomach cancer even before the onset of their symptoms. And if you fall into this high-risk group, you should consider seeing your doctor or even our screening center to discuss about doing this test. Another way of detecting a helicobacter is through breath test, and this test is also now available, and it's again a breath test or even a blood test, which is a non-invasive way of early detection of stomach cancers at an early stage. And I hope this will be useful for your consideration.